What are the risk factors for developing myelofibrosis?
Risk factors for myelofibrosis include older age, so most patients are over the age of 50 when they're diagnosed. There's also links to certain chemical exposures like toluene. So if you are a nail technician, you're often exposed to toluene. If you're a painter, the fumes from the paint thinners and paint itself can have toluene. Benzene exposure is another risk. So if you work nearby underground gas barrels that are leaking or work in a plastic factory. Benzene's also in cigarettes, so cigarette smoking is a big risk factor for myeloproliferative neoplasms, which include myelofibrosis. And then certain high-dose ionizing radiation, like a Chernobyl exposure, for instance, can also predispose to myelofibrosis.
So some of the risk factors are having a preceding bone marrow disorder. One of those are having other types of myeloproliferative disorders. The classic ones are polycythemia vera, which is abnormal production of red blood cells, or essential thrombocytosis, which is abnormal production of platelets. And so these two disorders have a long history, but at the end of many years, oftentimes decades, many of these patients progress to myelofibrosis. Or patients can be diagnosed de novo, just having abnormal blood counts. Some of the risk factors are having one of those disorders of a myeloproliferative disorder, having a family member with it, even having an autoimmune disorder, and of course some of the known risk factors of unhealthy lifestyles such as smoking.